Here's one way to release a headache or jaw pain at home. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and birth healing specialist. We're going to talk today about how to release the temporal bone. So I have just a model of the head here, and you can see different bones of the head. And I'm going to show you how to release this bone here on the side, just above your ear, called the temporal bone. You have one on either side, and they're here in orange. And you can see how it's very, very close here to the jaw. So if you have TMJ issues, that's the temporal mandibular joint. So that's the temporal here where the mandible meets up. So it's very common that people have, say, jaw pain or soreness when they wake up in the morning, or they, during the day because they clench their jaw. And it may lead to some head discomfort, headache, if you will. So I want to show you a natural way at home to relieve this. We're going to basically do what we call ear pulls. So what you can do here is get your elbows up onto a desk or a countertop, just something that you can rest your arms onto. Works out really well. Then what you can do is just take your fingers, and I suggest you can hold on a couple different ways. You can either hold on at the earlobe, but I do find sometimes that the fingers slide off. Or you can hook one finger inside of your ear and then the other kind of around, so you're grasping the ear lobe itself a little closer. So I prefer that way because otherwise, like I said, kind of slides right off. So what you can do from here is we're going to do a myofascial release. And you want to do this, again, you want to be supported so that way your arms don't get tired when you do this. And basically what we're going to do is take the ears and use them as handles of the body to give a little bit of a tug to these temporal bones, and that can help to release a lot of that tension that you might be experiencing in and around your head and down into the jaw. So we take a hold here, and what I want you to do now is grab a hold, and you're going to pull out almost like you're trying to pull your ears, and just to the point where you feel a little resistance, like your body's pulling back against you. And then you're going to bring your hands down towards your shoulders. So you're going out to that barrier where your body stops you, and then you're going to come down towards the shoulders. So we're going to do that, out and then down. Okay. Now I'm not putting a lot of force into this. I'm not being aggressive. I'm not trying to force my body to do anything. I'm really just stopping where my body pulls back. So it's a very gentle release. You shouldn't feel like your fingers are getting tired or that your arms are getting really tired. And when we get to that barrier out and down, that's where we want to stop. And we just want to hold right there. And this is where you're going to have to be patient. When we do myofascial release, we want to allow the body to start to let go. If we go in too fast or too hard, what happens is the body wants to resist and kind of pull back in a way of protecting yourself. So we don't want to get to that point where we're being aggressive. Now, when we do myofascial release, it can take 90 seconds up to 2 minutes for the body to start to soften and let go. So this is where you need to be patient. And just pay attention to what you're feeling. So you may find that your fingers, your hands are moving different when your body does start to let go. And that's okay, meaning like maybe your right side's releasing, but the left side seems like it's not doing anything. Or maybe, your left side goes up a little higher and the right side goes down. Okay, that's okay. When you're first getting started, you might not trust what you're feeling. You might feel like you're making it up, or that can't happen. You might try to, in a way, talk yourself out of feeling what you truly are feeling. And that's normal. But just be patient here and allow your fingers, your hands, to go where your body is guiding it, and trust whatever speed or direction of movement is happening. So it can be very subtle. And if this is your first experience with this type of work, it may take a little bit of time for you to get the hang of it, and that's okay. Give yourself some grace. But basically, we want to follow the body barrier upon barrier. So you might, what I mean by that is, as you're pulling, again, fingers might move different. You might feel like it may be really subtle. I'm moving my hands a lot here to show you, but it may be really subtle on what the body's doing. It might move in different directions or different speeds. One side might move and the other feels like it's not doing anything. So what we're doing is we're releasing the connective tissue of the body. And that is three-dimensional, meaning it goes in all directions in your body, okay? Up, down, diagonal, and it covers every single structure of your body. So we're using the ear, which it's not shown in this model, but the ear sits right in through here, right? We're using the ear to pull out to release along any of that connective tissue and release even along the bone, so we don't have all that tension around the muscles, into the scalp, or even down into the jaw. Even though we're not touching the jaw, again, because the mandible here attaches right where that temporal bone is, they're very closely connected. So give this a try. What I suggest, don't get in a hurry. You've heard me say that. Be patient. I want you to try to hold, if you can, for around 5 minutes. That's ideal. At the very minimum, you should hold for 3 minutes doing this technique because, like I said earlier, it can take up to 2 minutes for things to start to release. So give your body that little bit of nudge, that little bit of pulling, and give it a chance to actually make some changes. So 3 minutes minimum, but ideally, if you can hold 5 minutes or longer, that's okay. As long as your body's moving and you're feeling some changes, that's a good chance that it needs you to just be patient and continue to hold. All right, that is all for this Ed Talk. I appreciate you being here and listening. If you do have headaches, migraines, tension in your jaw, and you want a little bit of help around this, maybe this video was helpful, but you're sitting there at home and you really like a little more guidance on what's going on in your particular body, please reach out to us here at the Healing Spot. You can go to our website, healingspotpt.com, and choose whatever option works for you. You can request a discovery session where you can sit down with me face to face or meet me on video, and we can talk about your particular concerns, or even fill out an inquiry form and ask about our services. Thank you so much for watching this Ed Talk.